everyone. Thanks for joining me today. I am Elizabeth Miller, the Functional Medicine Certified Health Coach at Vallejo Health and Wellness Center, and I am here today with Dr. Tara Kaur, who is a biological dentist in the Twin Cities. So, Dr. Kaur, just to start us off, could you tell us more about what it means to be a biological dentist? How is that different than, other dentists around the area?
Sure. Well, thank you for inviting me to this conversation. I'm always excited to connect with integrative healthcare practitioners, and I appreciate this opportunity. So I just want to say that first.
Yeah.
And then, yes, biological dentistry is kind of a big topic. So there's, different practitioners that practice along the whole scale, but I'll try to kind of filter it down. So biological dentistry is basically understanding and respecting the philosophy that each person is individual. And so procedures, products, materials, supplement, nutrition, all of that is going to vary from individual to individual. So as a dentist, I am putting things in people's bodies as far as fillings or things like that. I'm recommending different products or different ways of taking care of your oral health and your oral wellness and your whole body wellness. So I'm just recognizing that one size doesn't fit all, and that what I'm doing can very much impact you positively or negatively. And so there are different things that we do in our practice to really individualize our care and provide services that are patient-centered, not a one-size-fits-all equation.
Yeah, I absolutely love that. I love that you're really pointing out that it is very patient-centered in that very individualized way. We take very much so that same approach where we are making sure that we are learning about each person, what works well for them, what, really will support their health and their bodies. So obviously, like, good oral health, especially from a very holistic standpoint, starts from the moment you're born, or maybe even before you're born. And one of the things that I'd really love to highlight today is kind of kids' oral health and talking about how you can really set your kid up for success from, the moment it really starts to matter. So I was hoping you could speak more to us about that and what that might look like.
Absolutely. So I would absolutely agree with you on that point. I think that the health and wellness of the baby begins with the health and wellness of the parents. And so people that are planning families, people that are planning children, obviously surprises happen, but getting yourself and your spouse or whoever is the partner in the relationship as healthy as possible, I think is one of the fundamental, principles of a healthy baby and a child that has a healthy immune system and can thrive and function and grow into a healthy adult. So I really think it happens before conception. And that's one of the things that I talk to a lot of my parents about and a lot of my patients about is, if you're thinking about having babies, think about the metals that are in your mouth. Think about if you have periodontal disease, what is your bacteria like in your mouth? Things like that really will affect the health and how you're, the chances of your child having healthy mouths and, growing up and not having issues. So I think it starts there. Okay. Then in pregnancy, obviously there's a lot of demands on the mama bear. So making sure that when we are in that period of time, that's when the baby teeth, well, all sorts of things are happening, but that's when the teeth are forming, is in utero. And so if there is too much of a particular mineral or not enough of a particular mineral, or if there's toxins that are being processed or taking antibiotics or things like that, can absolutely affect how the teeth and the tissues of the baby are developing. So healthy pregnancy, working with someone like yourself to ensure that there's proper nutrition, it's getting broken down and assimilated appropriately. Then once the baby is born, then we need to talk about how the immune system is formed, when, particularly the immune system in the mouth, but the whole body. So when a baby is born via vaginal delivery, the microbiome of mama that the baby moves through populates the mouth. Okay, so if we have a C-section delivery, there's probably going to be some impact on the child's microbiome in the mouth and probably the gut too. And that's something to be aware of. The other thing that populates the mouth, so the baby comes out, there's no bacteria. They don't have that immunity, right? They don't have that balance. So they're getting that from their environment. So one is mom, two is whoever the baby is kissing, sharing spoons with, you know, all of that. Your mouth that you are kissing your baby with, that's how you populate the healthy or the unhealthy bacteria into the baby's mouth. So again, it comes back to the parent, right? And making sure that you're clean and you're healthy and everything is going well there. And that's going to set the child up for success. Okay. So that's kind of that piece. Now, there are very important muscles that are in connective tissue that's associated with healthy growth and development. And so one of the things that's very much in the awareness right now is tongue ties, lip ties, those sort of things. So baby can be born and there can be some connective tissue issues with the anatomy that are not going to be helpful in nursing or, you know, proper swallowing, airway, all of that. So finding a dentist or a physician or a health coach like yourself that understands the importance of those connective tissues. And if we are seeing any of that, addressing it immediately and then working with like a lactation specialist or someone to make sure that we're getting baby healthy food. Okay. So that would be the next step.
Right.
Then after that, as they grow and develop, we just have to watch for things like tooth grinding. We have to watch for snoring, restless sleeping, sweating while we're sleeping, things like that, that can give us indications that there's some sort of airway compromise or the growth and development of the muscles in the skeleton just isn't working appropriately. So those are things that we talk to all of our parents about. The other thing that comes up a lot with kids, particularly in this kind of toddler, you know, age, digit habits. So thumb sucking, finger sucking, when do we wean, when, you know, all of that kind of stuff. And there's an important part of the palate that is a very important acupressure point, and there's a little neurological plexus that's up there. And what happens is when we apply pressure to that spot in the roof of the mouth, it calms the nervous system.
Oh, interesting.
So if the baby or the child is feeling anxious, nervous, you know, tired, whatever it happens to be, the digit pushing up against the roof of the mouth actually is it's a self-soothing mechanism to calm the nervous system of the body down. Okay. So a lot of parents, you know, oh my gosh, they're sucking their thumb at 2, you know, or whatever. Yeah. And yes, that can lead to some big problems if we continue to do that. But usually digit sucking once kids have teeth is because their muscles aren't functioning and they're not able to get their tongue up to the roof of the mouth to be able to apply that pressure appropriately and then be able to, you know, keep the nervous system.
Yeah, that's so interesting. I guess I never knew that about, you know, finger sucking or maybe thumb sucking, or maybe the kids who really feel like they need that pacifier.
Right.
So is there anything that you do as the dentist to help them strengthen that muscle so that they can better transition away from thumb sucking or their binky or passy or whatever you want to call it?
Exactly. So my job in all of this is to identify it, right? And that's why it's so important, I think, for parents to understand that, you know, baby teeth are important, and when they come in, definitely you should be seeing a dentist. But the development of the face, the palate, the airway, you know, all of these things are happening immediately until they're, you know, and then through the point of where their teeth come in and then beyond. So really seeing somebody that knows what they're doing and has experience and understands the importance of the connection of all of these systems of the body. And, you know, so for me, my job is to identify it. Okay. If you got a tongue tie, lip tie, I see oral myofunctional imbalances in the mouth. We've got mom saying baby snoring, or we can't get rid of this thumb habit, or whatever it happens to be. I can identify what's going on in the facial development. And then if we do need a frenectomy, or we do need some sort of expansion of the palate or some help for the skeletal growth, then I work with a team of practitioners, you know, dentists and orthodontists and pediatric dentists and whoever else it happens to be, oral myologists, to get you referred to the right resources, so then we can intervene and intercept, so that we make sure we're not missing those important stages of growth and development. And meanwhile, we're not stressing out the kid. I mean, this is the way they start feeling calm. So if you say that's bad and you can't do that, you know, you're definitely gonna miss something there, and then it can be more challenging for the child.
Yeah. I feel like you've already shared so much helpful, good information. So just kind of reviewing some of the things that we've learned so far. First of all, like baby's oral health really starts preconception, starting with especially the mother's health, but also the father's health. Just that, you know, when they are a baby, they are really accumulating or developing that oral microbiome through birth, but also while sharing things with parents, you know, like you were saying, the spoons, the straws. I would say too, to make a point of, that means also siblings, right? Siblings are often sharing all of these things. So really making sure that good oral health is a family endeavor.
Yes, absolutely.
Awesome.
Well said. Yeah.
Yeah, thank you. So yeah, all of that is just such good information. Making sure that preconception and throughout pregnancy, you have the correct balance of vitamins and minerals to support that tooth bone development. And then moving along, just making sure that baby's nutrition is good too. Have you seen anything that works particularly well, or anything that you want to note, like that can be particularly detrimental to baby's oral microbiome in terms of food, or just anything that they might really be putting in there?
Yeah. So of course, and I'm sure your population of people that are watching this video or this conversation know that, you know, healthy nutrition is the foundation of everything, right? And again, we're all individuals. So for me, you know, avocados might be healthy, and for someone else, they may not. So, you know, it's finding what works for each person. But as a general statement, we want to stay away from things that are processed. We want to stay away from things that are GMO'd. We want to stay away from things that are, you know, high sugar content, refined sugar content, those sort of things. And we really want to eat some, you know, a basic nutritional lifestyle that is organic, whole food based, you know, all of those good things. But the biggest thing I think that I've found in my clinical practice, and just doing research into like anthropology and how we developed as a species, is one of the things that I think can be tricky in our day and age is when the baby teeth come in and we are still nursing the baby, or the baby still has a bottle if we're not nursing, there can be some vulnerability there, okay? So once the baby is nursing and eating solid foods, it's different than when the baby is just nursing. So if we are eating solid foods, okay, and we have stuff on our teeth when our baby does, when the baby's going to sleep, and then we wake up at 2 in the morning and we nurse, okay? Now we have food debris on the teeth, and now we're adding sugar to the mix. And now we have bacteria in the mouth, and now we get cavities, okay? So, you know, there's this whole term, baby bottle decay or nursing decay. And I can't tell you how many kids I've seen where they're healthy kids, they're healthy diets, they're healthy parents, and all of a sudden they're 3 years old and they have a mouthful of cavities. And this is because they're nursing and eating solid foods, and the parents aren't necessarily understanding the importance of cleaning the mouth. The other thing that's really important is a lot of the baby foods that we think of when we're transitioning baby from nursing to solid foods are soft foods, right? So we give them the Cheerios or whatever you want to call it. We give them the applesauce. We, you know, do those sort of things. Babies need to chew hard foods in order to develop the muscles right. So
interesting.
we have to be careful. We're not aspirating anything, and there's obviously a transition there. But the sooner you can get baby eating crunchy foods, you know, the more those facial muscles are going to develop better, more optimally, and the more you're going to get, you know, healthy facial growth and development. Now, if there's a tongue tie, right, you're not going to be able to swallow right. And then solid foods can be really tricky, and we can find kids start getting picky about what they're eating. And it's not necessarily a texture or a flavor or something like that. It's that they can't physically chew the food right and swallow it.
Yeah. So, and I have to admit, I'm not overly familiar with tongue ties. So is that something where it might go unnoticed until that point, and then you start to notice, oh my gosh, my kid is such a picky eater. They don't like these things that are more difficult to chew. Red flag.
Right.
Could be a tongue tie.
Right. Or noisy, messy eating, tongue tie. Gasping for breath while the child is eating. I mean, I'm not saying it's guaranteed that it's a tongue tie, but that's something you should definitely be looking at. So my advice on all of that is find a good, holistic, biological dentist that knows how to identify these things so that if your child does have some limitation or some predisposition to some challenges, we can identify it early, get it corrected, and then the baby can grow and develop, you know, more normally and more optimally.
Yeah, absolutely. I always love that root cause approach, and, you know, not just covering something up with a Band-Aid or trying to fix that one symptom, going to the root, making sure everything is good and healthy and will help that individual baby, kid, adult thrive into the future. So I know that you do have a limited amount of time with us today, so I want to make sure that we are being cognizant of that. So we have a couple of minutes just to wrap things up. I think for the most part, we covered really the main topics that I wanted to make sure we get to today in terms of kids' health, just as we wrap up our Kids' Health Month at Vallejo. But are there any last thoughts, ideas, recommendations that you would want to share with us and our viewers?
Sure. So I guess there's just a couple of things. One would be like, how do we take care of kids' mouths? So, you know, oral hygiene is important. And again, if we're getting proper nutrition and all of that, you know, your body is an amazing thing. It will 9 times out of 10, if you give it what it needs, it will heal itself.
Right, which is amazing.
Right. So, you know, in our dental practice, we are not advocates for fluoride. There is lots of science out there that really shows some of the negative consequences that, or potential issues that chronic low dose fluoride exposure can set you up for. So there's some good information on our website, and, you know, and hopefully you can share our website with people, because there's info on that. But I would just say a non-fluoridated oral hygiene products is the way that we go in our dental practice. But we do need those minerals to be able to do the repair work to the enamel in case it is being damaged just with normal function.
Right.
So a couple of good sources of minerals would be baking soda, okay, or like a calcium carbonate, silica, some types of clay, like a bentonite clay or a diatomaceous earth can be helpful. And then, you know, with babies, they can, or with children, they can be more sensitive to, like, baking soda is going to be really salty, right? So they may not like that. So it can be tricky sometimes finding something that your child will accept. But there's so many now, there's so many great fluoride-free products out there. You know, there's great recipes where you can make your own at home, and that's a much more ecologically friendly way to do it. You know, and we've got, again, good resources for our patients on all of that. But I would say a fluoride-free product that's clean, so it doesn't have a bunch of SLSs or additives, preservatives, nanotechnology, all that, just make it clean. And then, you know, getting into those healthy habits. So we need to brush our teeth. You know, if we don't, we're going to get some sort of issue. And flossing, once the permanent teeth start coming in, is an important habit to develop. And then, you know, healthy nutrition and being excited about being healthy, and just modeling those healthy behaviors and choices for our parent, or for our children as parents.
Yeah, absolutely. That is all just such great information. And hopefully you and I can connect again some
Yeah,
point down the line and maybe
yeah.
have a couple more discussions just to help share this information with people. But I really appreciate you taking the time today to get us started with talking about that kid, baby, oral health and how we can really start focusing on that before baby even arrives. So again, Dr. Tara Kaur, thank you so much. I'll make sure to include the link to Dr. Kaur's website with the video when it's posted. And yeah, hopefully everyone has learned some great information today, and we will see you all again soon.
Thank
Thanks.
you.